consequences of this bill for the elderly are horrific. But for young people, they're just as bad. This bill says that if you don't buy health insurance,
You go to jail.
if you don't spend $15,000 buying health insurance, and you get a subsidy only after you've spent 8 or 12% of your income, and only if your combined household income is below $60,000 a year. If you don't spend that kind of money on health insurance, you have to pay the government a fine equal to 2.5% of your total income. And if you don't get the insurance and you don't pay the fine, you go to jail. Up to 5 years. So imagine the prison yard of the future. What are you all about? I murdered somebody. You rape. You. I didn't have health insurance. And then, so what's going to happen is most of the people that don't have insurance, who are maybe young, maybe childless, they may say, I would like catastrophic insurance in case I get hit by an anti-healthcare reform bus. But until then, I don't need for every doctor's visit and every dentist visit. I'm a healthy person. I don't have any kids. Well, the government says catastrophic insurance doesn't satisfy our requirement. You got to buy the whole thing. Because their goal is to finance the system by the excess premiums you're going to pay. So what's going to happen is that those young people are going to say, hey, my wife and I make a combined income of, say, $50,000 or $60,000. You know, she's a teacher and I'm a cop. And we can't afford to spend $8,000 on health insurance, which we'd have to pay before the subsidy kicks in. So we're not going to do that. We're going to pay 2.5% of our income, about $1,500 as a fine to the government. We don't get anything for it, but at least we stay out of jail and we save ourselves those premiums. And they'll do that this year and next year and next year and next year and next year. And then when they do get hit by a bus, they say, okay, now I need coverage. And under this proposal, the companies will have to give it to them and can't raise the rates. So who's going to pay for it? The whole theory of insurance is you take the premiums year after year after year when they don't need them, and you save them up for when they do. But here they won't be paying for it. So who's going to be paying for it? All of us. And it'll cost an estimated $2,000 extra for health insurance for every family in the United States. And then they're going to tax your health insurance. Now, right now they say it's only a gold-plated tax. But Obama's kind of a reverse alchemist. He turns gold into bronze. What's going to happen is that if you make, if your premiums right now are more than about $600 a month, you're going to have to pay 40% of your premium as a tax. And that's not indexed for inflation. So year after year, more and more people are going to be taxed. The estimate is by the 4th or 5th year of this bill, everybody who makes more than $75,000 a year combined household income will have to pay a tax of 40% on their health insurance. And then, as if that isn't enough, they raise taxes on medical devices. They tax pacemakers. They tax arterial stents. They tax automated wheelchairs. They'll tax hearing aids. The prosthetic limbs that our brave young men and women need if they've been injured in Iraq and Afghanistan, those are going to be taxed too. And you know why he's going to tax them? Not just to raise money, but to punish the medical device industry, because it failed to go along with his bill, unlike the AMA and AARP that went along with it. They're singled out for punishment. And then finally, there's the dumbest thing I ever heard. He's going to tax sick people. He really is. If right now you can deduct on your income tax any medical expenditure that's more than 7.5% of your income, he's going to raise it to 10. Can you imagine being sick enough that you have to pay one pre-tax dollar out of 10 to go for your health care? If you're in that situation, He's going to tax an extra 2.5% of your income. That's $600 you're going to have to pay on average, taxing sick people. Now the real question is, can we beat this bill? I give you this message. You